South Africa is one of the largest medtech markets across Africa and the Middle East. It has created up to 30,000 jobs with an estimated value of 21 billion rands in 2021 and now projected to grow to 29.6 billion rands by 2025. Minister Ebrahim Patel says the desire is to expand the offering of the sector significantly.
First, where we're currently importing products, and we import more than 26 billion rands worth of these medical tech products. Some of these we now want to localize and produce here, but we also want to be able to export more to global markets, particularly other African countries through the African Continental Free Trade Area, but also to the European Union and the United Kingdom. South Africa has a history of innovation. A South African was the co-discoverer of the CT scan. We have a significant product in the market that does these low-dose X-rays, and there are many other products that are innovating products. So this brings together a partnership in which the regulator, which is SAPRA, work together with the industry. The National Department of Health and provinces will work on how to get procurement from South African producers, and the private sector, the private hospitals and the pharmacies will be partners to try to localize more products here in South Africa. The purpose of this is to create jobs.
According to the South African Medical Technology Industry Association, currently the bulk of the assembled medtech products and materials necessary for the limited and mainly small-scale manufacturing are imported and present a significant portion of South Africa's trade deficit. CEO of Proudly South African, Eustace Mashimbia, says the Masterplan is a positive step in elevating locally made products on the global stage.
At times, the challenges that arise come from issues like availability. Availability sometimes become a concern, especially in an industry like this, where there's been historically dependence on global supply chains, and so when there were disruptions like we saw during the COVID-19 pandemic, we needed to start fending for ourselves. And in fact, a lot of success stories, which the minister also touched on today, came out of this industry. Work done by the likes of CSIR, working with the different social partners. So a lot of companies pivoting and starting to make that which we did not previously make in the country, but which was required during the pandemic locally. And some of that capacity still sits and is available to us, but it's not necessarily utilized because the demand side is not coming to the party. And so with this master plan, we're going to start utilizing that, and then we'll then achieve what is also another challenge, which is pricing. With economies of scale as a result of increased demand and placing of orders within the borders of South Africa, we will then achieve that price point.
Dr. Brett Lindell Singh, a young medical doctor and healthcare entrepreneur, is optimistic about growth in his business emanating from this master plan.
We believe as the development of the African Free Continental Trade Area and Agreement continues to expand, younger companies like us that are less than 5 years old see a huge potential over the next 10 years to see us becoming champions over those years. So we do believe that the fruits of this master plan will definitely be the SMEs that are coming out of this, to see how we can latch onto these policy advantages so that we can get South African products across to Africa and across the rest of the world.
Signatories of the master plan include the DTIC, the National Department of Health, Medical Device Manufacturers of South Africa, the CSIR and COSATU, among others. Diabosito, SABC News, Johannesburg.